Hola, my name is Dr. Manny Gonzalez. I am a primary care pediatrician at Santa Clara Valley Healthcare. Let's learn about common Latine medical beliefs and norms around illness, recognize helpful versus harmful practices, and how to educate patients with cultural humility. In my short time as an attending pediatrician, I've heard many stories from patients and families about the cultural beliefs and home remedies they rely on. Some of these practices were familiar to me. I knew about them peripherally, but I realized I didn't fully understand their significance or safety. Understanding these beliefs is essential for effective communication, providing quality care, and building trust with families. The case we will look at today is an amalgamation of many experiences that highlight common themes encountered in clinic. You may hear and see these beliefs and remedies in practice, but it's important to recognize that even within a cultural group, individuals may hold differing views and practices, and each family's approach to health is unique. Miguel, a 6-month-old infant, is brought to the clinic by his grandmother, Amalia, who is deeply worried about his health. Initially, Amalia believed Miguel was suffering from empacho, since he seemed uncomfortable, fussy, and had mild bloating. She gave him herbal teas, massaged his abdomen, and consulted a sobador. Over the next 2 days, Miguel began crying excessively, refusing to eat, and developed vomiting, diarrhea, irritability, and caída de mollera. Concerned that something more serious was affecting him, Amalia grew convinced that Miguel might have mal de ojo. The family tied a red bracelet around his wrist, turned him upside down while gently massaging his palate, and took him to a curandero for a limpia. On exam, Miguel is found to be mildly dehydrated, likely due to viral gastroenteritis. Amalia requests antibiotics to treat his vomiting and diarrhea. Now, let's pull out some key points to learn more about this family's cultural practices. Initially, because Miguel was fussy and bloated, his grandmother thought he might have empacho. Empacho is an intestinal obstruction caused by foods high in spice, fat, or fiber, overeating, undercooked food, or infection. Treatment often involves intense abdominal massage to help move the food along, as well as home remedies like manzanilla, chamomile tea, ginger, garlic, lemon, and baking soda. Some also use azarcon or greda, fine powders mixed with juice, formula, tea, or oil to relieve symptoms. In terms of safety, massage generally safe. Providing fluids is an important part of the treatment for dehydration. However, the use of azarcon, lead tetraoxide, and greda, lead monoxide, is a harmful practice. These fine orange powders are traditionally used to treat empacho, constipation, diarrhea, vomiting, and teething in infants. These powders contain extremely high levels of lead, sometimes up to 90%, which cannot be detected by sight, taste, or smell. Even small amounts of lead can cause serious harm in children, including developmental delays and learning difficulties. Many families use these remedies out of trust in long-held traditions, but it's important to counsel families that these substances are toxic. Counsel the family that there are safer, evidence-based alternatives, in this case, hydration is key, are available to help the patient heal without the risks of lead exposure. The family initially consulted a sobador. A sobador is a traditional healer skilled in the art of massage therapy. Sobadores focus on restoring balance and health by applying targeted pressure and manipulation to the body, believing that the body's energy can be realigned through their techniques. Many families seek the help of a sobador when they feel conventional medicine may not offer relief, or when they prefer a more holistic, culturally rooted approach to healing. Recall that one of the symptoms Amalia was concerned about was the caída de mollera, or the fallen fontanelle. A fallen fontanelle is thought to be caused by improper handling of an infant, quickly removing the infant from the breast while feeding, or other sudden movements. Traditional treatments involve massaging the head or palate, or even turning the baby upside down to restore balance. From a medical perspective, a sunken fontanelle is typically a sign of dehydration, which requires prompt attention and focus on hydrating the infant. Amalia grew convinced that Miguel might have mal de ojo. The belief in the evil eye, or mal de ojo, is common in many cultures. It is thought that a jealous or envious glance, whether intentional or unintentional, can cause harm, especially to a child or infant. The harm is believed to come from someone with an intense eye looking at the child with feelings of jealousy or envy. To prevent or treat mal de ojo, some practices include touching the infant while glancing at them, wearing a mal de ojo amulet or red bracelet to ward off the negative energy, or performing a limpia to absorb the harmful energy. In terms of safety, wearing an amulet or bracelet poses minimal risk. A limpia is a form of spiritual cleansing. This is often performed by a curandero, a traditional healer that uses a combination of herbal remedies, prayer, and rituals to treat both physical and spiritual ailments. Many families seek their guidance before consulting a medical doctor. The limpia is based on the belief that eggs have the power to absorb negative energies, emotions, and even illnesses from a person's body and energy field. During the cleansing, the curandero will rub the egg over the person's entire body, including key energy centers. This is often done directly on the skin, though clothing may be kept on for modesty. The goal is to draw out harmful energies. The curandero may chant prayers or use other objects like feathers, flowers, smoke, holy water, or crystals to enhance the cleansing. Once the egg is done absorbing the negative energy, it is broken into a glass of water. The appearance and movement of the egg's contents, such as how it floats and the look of the whites, are believed to reveal symbolic messages that a skilled curandero interprets to determine what energies have been cleansed. Finally, the water with the egg is flushed away, symbolizing the washing away of negativity. Now that we've learned about some of this family's practices, let's remember to provide our medical advice, while still respecting the family's beliefs. In this case, Miguel likely has a viral illness. Acknowledge that Amalia was right to be concerned about the caída de mollera, as this is a sign of dehydration. Counsel that treatment is supportive, we replace the fluid and electrolytes being lost. Most importantly, we avoid unnecessary medications. We advise that antibiotics will not be helpful in this case, as those are used to treat bacterial infections, and the vast majority of gastroenteritis is viral in nature. Counsel that signs of severe dehydration, no urine output for over 8 hours, the child being unusually tired, having sunken eyes, dry mouth, or a fast heart rate, should prompt medical evaluation. As we bring this lesson to a close, let's take a look at some key principles of culturally responsive care. First, acknowledge and respect beliefs. It's important to validate parental concerns without dismissing cultural explanations. These moments are opportunities to build trust and connection with families. Next, educate with clarity. Help caregivers understand when to seek medical care and clearly distinguish between safe and unsafe practices. Use simple, evidence-based language and the teach-back method to make sure information is understood. Then, promote effective communication. Always use qualified interpreters and make sure explanations are culturally sensitive. That's key to reducing medical mistrust and strengthening relationships. And finally, collaborate with families. Whenever possible, integrate culturally safe practices into care. Partner with caregivers to support adherence and achieve the best possible outcomes for children. Together, these principles help create care that is both evidence-based and deeply respectful of the diverse communities we serve. Let's use our framework of what one person can do, what a small group can do, and what requires a large group to do. Individual providers can take time to reflect on moments when cultural practices have surfaced in their care and use those experiences as opportunities to learn. Groups of providers can work together to bring culturally sensitive communication into daily practice, sharing insights and stories that strengthen understanding across the team. Large healthcare systems should ensure truly equitable, culturally competent care by supporting providers in obtaining bilingual certification to deliver language concordant services. Thank you for watching and continuing to build trust and understanding with the families you care for every day.